Welcome to the PCOS Fertility Health Podcast. I am your host, Dr. Angela Potter. I am an integrative PCOS fertility doctor helping women across the country, like yourself, to help regulate periods with PCOS and to improve fertility. If you are a new listener this week, I am super glad that you are joining us, and you are in exactly the right place if you have PCOS and you've been trying to get pregnant for the past 6 years and nothing is working. And of course, you see pregnancy in your future. You want to get pregnant and grow your family, but you're also concerned that if you got pregnant right now, that your body just wouldn't be ready for that. And you really want to get to the root cause of your fertility struggles. You want to feel really healthy so that you can have a healthy pregnancy, have a healthy baby. And you're also in that space of you're tired of meeting with doctors who are just telling you, well, your labs look fine, just come back when you're ready to go through IVF. You've been struggling for years, but you still really want to feel healthy in your body. And you know that feeling healthy in your body is going to translate to better fertility, because once you get your periods more regulated, you get your hormones back into normal rhythm, then you're going to feel really good in your body, and your body's going to be ready for that pregnancy. If that sounds like you are in exactly the right place today, and I am overjoyed to have you here. Right now, we are in a 5-part series talking about different root causes of PCOS fertility struggles. This is really important because PCOS is a syndrome. It's not a cut and dry diagnosis where we can say, this is exactly what's going on in the body with PCOS. This is one medication or one therapy that we can use to deal with that one thing that's going on with PCOS that's keeping you from getting pregnant and get you to a place where you're able to get pregnant. It doesn't get all tied up in a pretty little bow like that. PCOS is a syndrome. There's different symptoms that are creating this syndrome. And so it doesn't respond to just one medication or one therapy. When you see results with PCOS and fertility, that's when you take this holistic view of the body to understand how these different symptoms and how these different systems are creating fertility struggles, working on that to create this overall fertility health in the body. That's why talking about these different root causes is so important. You might have just one of these root causes. You might have a mix of all 5. It doesn't matter how many you fall into. What matters is that you figure it out and then get a plan that addresses what's going on in your body to turn that around, so then you have the best chance at getting pregnant with PCOS. So that's exactly what we're doing here today. We are talking about insulin today. That's a big topic with PCOS. Before we get into that, I want to be sure that you have downloaded your free gift that I have created just for you. This is a PCOS fertility checklist. It is a very clear 10-item checklist for you to look through to understand, okay, do you have these different elements of your fertility plan in place? If one of these or more is missing, then you have got missing links in your fertility plan. So it's a really simple way for you to just get, okay, I've got this, this, and this, but I don't have these things. And this is where I need to focus now moving forward to help improve my fertility. So you can go ahead and grab your free gift over at drangelapotter.com/checklist. And if you want to support this podcast, you can leave a 5-star review over on Apple Podcasts. Let's get into these juicy details about insulin. When we're talking about insulin, we're talking about blood sugar. And the reason this is so important is because it's estimated that 80% of women with PCOS have insulin issues. And we know it's been well studied that elevated insulin shuts down ovulation. If you are struggling to get pregnant with PCOS, insulin and blood sugar should be one of the very first things that your doctor is hopefully talking with you about to understand, is this an issue for you? Because again, 80%, that's a very high number, but it's not 100%. So you could very well fall out of that and not have any insulin or blood sugar issues. But if you fall into that very common group of women, you want to know today because yes, you can turn blood sugar issues around, but you want to get started on that today because your blood sugar changes on a daily basis, and so you want to be mindful of what you can be supporting your body with now so that every day you can be supporting this really nice blood sugar balance throughout the day and these lower insulin levels so they are not impacting your ovulation. One study even found for women who were not ovulating, they were looking at reasons why this group of women was not ovulating, and they found that 95% of women who weren't ovulating in this study had insulin resistance. Insulin plays a very direct role with ovulation. And this is another important reason why we're talking about this, because I will say this again and again, that fertility health is whole body health. When you get stuck into that type of fertility plan that is hyper focused on your reproductive organs, your reproductive hormones, and doesn't look at this greater picture of what's going on with your body, then you get stuck. Even though you're on this fertility plan, even though you're getting this medication, like say you're on a medicated cycle with letrozole or Clomid or both of them, yet you still have elevated blood sugar issues. You can push that egg out of the ovary with that medication as much as you want, but if you still have elevated insulin and irregular blood sugar issues, your chances of getting pregnant are still low because your body needs to create this whole environment for pregnancy. There are different steps. There's many different steps in the process. Getting that egg out of the ovary, that is one step of many. And so if that egg is pushed out of the ovary, and yet your uterus is not prepped for pregnancy, or your body has all this inflammation that is not allowing for implantation, then sure, that's great that you got the egg out of the ovary, but your body is not yet ready for pregnancy. And so that's why it's key to really get that in your mind, and how you're supporting your fertility health is to think of it as whole body health. And blood sugar and insulin is a really important part of that. Let's talk about what insulin is and what blood sugar is. Well, when you eat food, say you eat breakfast, then your blood sugar rises because you are getting fuel in from your food. And then your body wants to use that fuel. It wants to take it out of your bloodstream. So then your pancreas releases insulin. Insulin is a hormone that allows that blood sugar, that blood glucose, to go into the body's cells. So then your body can use that for energy. So when your blood sugar levels are really high and then they crash, that crosses the wires with this connection between blood glucose and insulin levels, which leads to higher glucose in the bloodstream, more insulin getting pumped out. And how does that equate to fertility struggles? How does insulin cause so many fertility struggles? Well, when insulin is elevated, that then increases LH levels. LH is a hormone that is released from your brain that helps with ovulation. But when insulin is pushing LH levels, that is then telling the body to also raise testosterone levels. You might be familiar with testosterone. If you've been listening to this podcast for a while, you certainly are. Testosterone is that male pattern hormone that is a part of the PCOS diagnosis. When a woman, somebody with female hormones, female organs, who's trying to get pregnant, has too much testosterone, the elevated testosterone in the body basically creates this big block. It shuts the door on ovulation. It starts creating all these signals in the body that says, oh, we don't need to ovulate. That's good. We're done. This process doesn't need to happen. So the more testosterone there is, that shuts down ovulation. That elevated insulin, yes, it's contributing to increased testosterone, but even before the egg is pushed out of the ovary, which is ovulation, it is impacting egg quality. So we know for people who have elevated insulin levels, they have lower rates of mature follicles in a given cycle. It affects egg quality and then also stops the egg. If one has gotten to that mature place, it stops that egg from being able to ovulate. So big reason of anovulation of somebody not ovulating with PCOS. So that's how insulin impacts fertility. You may still have blood sugar levels that are going too high and falling too low without having elevated insulin. You might not have insulin resistance on your blood tests. You might not have prediabetes, any of that, but you still have blood sugar levels that are going too high and falling too low because it's a process, right? Your body responds to these spikes and these falls in your blood sugar over time. And then it kind of creates this tipping point where all of a sudden your body then has that insulin resistance. You might be in that space where you haven't developed insulin resistance yet, but you still have a lot of spikes and falls in your blood sugar levels. And that is contributing to inflammation throughout the body and oxidative stress, which is still impacting egg quality. It's impacting your uterus. It's impacting implantation rates. When you're in this position of your doctor is telling you, well, your labs look fine, just come back when you're ready to go through medications or go through IVF, and you're thinking, but if my labs are fine, why am I not pregnant yet? Why am I still having irregular cycles? Blood sugar is going to be an important part of looking at the root cause of what's keeping your cycles irregular. Because maybe your doctor hasn't ordered the right labs yet. And so you still have these blood sugar issues that are going not taken care of. And they're continuing to contribute to you not ovulating. And I have seen this. I have seen women who come to see me and have been working with two different doctors, fertility doctor and their regular doctor, for 2 years before coming in to see me. No one has mentioned their blood sugar levels. And then, they're talking to friends and their friends saying, hey, have you gotten your blood sugars tested? And they go in and get blood sugar tested and it's elevated. And so now all of a sudden they know this is one of the root causes of why I'm not pregnant yet. But what have we been doing over these past 2 years that I've been working with these doctors? You do not want blood sugar to be one of those missing links in your fertility journey because it's low-hanging fruit, particularly with PCOS, because we know so many women with PCOS are already set up for having blood sugar and insulin issues. And two, your blood sugar changes on a daily basis with the foods that you're eating, how you exercise, all of these different elements that you can be positively supporting on a day-to-day basis. How do you know if you have insulin issues? Well, there's blood tests, pretty simple blood tests that you can get done. You can get your insulin levels tested. You can look at glucose. You can get your fasting glucose levels tested. You can also get a test called hemoglobin A1C, which looks at the average of blood sugar levels in your body over the previous 3 months. That can be a nice indicator. You can also get a glucometer, which is something that you either prick your finger with or you can get one put into the side of your arm, and that'll test your blood sugar levels throughout the day, before you eat, after you eat, and then you can see how high and how low your blood sugar levels are going. So those are some tests that you can get done. There are some very classic symptoms that you could be experiencing that you would say, I'm having these quite a bit, so maybe I have some blood sugar issues. Those classic symptoms are going to be getting hangry if you miss a meal or go too long without eating, headaches, feeling blurry vision or kind of shaky, having sugar cravings, These are all classic symptoms if you've gone too long without eating, that it's like your blood sugar has fallen too low, which means earlier it had spiked too high. So, classic symptoms that'll tell you, yeah, my blood sugar is not doing what it's supposed to be doing, and you want to get that turned around when pregnancy is your goal. And so maybe you're in this space where, again, you've met with your doctor and they are telling you that your labs are fine, to just come back when you're ready to go through IVF or get medications, and that kind of answer doesn't sit right with you, and you want to get to the root cause of your fertility struggles. And so you're in this place where you're doing lots of research online and you're trying out different fad diets online because you're just left to your own devices doing your own research. Your doctor hasn't been giving you these, fertility supportive, nutrient dense nutrition plans for you to help with your blood sugar, to help with your fertility. And so you're just trying these different fad diets. A lot of fad diets out there that you find on the internet are not supportive of your blood sugar. They're also not fertility specific to support your body to be eating in this way that's setting up for optimal fertility. And that's something that I do with every single one of my patients because food and nutrition has been a passion of mine since the beginning. I mean, I started out as a nutritionist. I love food and talking about food and cooking food and helping my patients to develop a food plan that supports their cravings. Like, food should be really satisfying, but also nourishing. And how do we create this food plan that supports the body for fertility and supports this blood sugar levels? Because the food that you eat is directly impacting your blood sugar levels. And so that's what I do with patients through my PCOS fertility protocol. You don't have to be left to your own devices searching on the internet for what is the best diet for fertility. The information you're going to find is going to be very generalized, and what you need is a plan that is specific to your body's needs. Because again, like we talked about in the beginning of today's episode, PCOS is a syndrome. So your PCOS looks different from any other person who is also listening to this podcast today. Your nutrition needs, your blood sugar needs are going to be different than anyone else who's listening to this podcast. And that is the trick with turning your fertility around with PCOS, is getting that individualized attention for what your body needs in order to start getting regular cycles, to improve egg quality, and to improve your fertility. And that's the goal, right? You want to feel healthy so that you can have a healthy pregnancy and a healthy baby. It starts with an individualized plan. If you're in that space where you are left to your own devices, just searching online for how to nourish your body, looking up different fad diets, you've been to doctors and they just keep telling you the same old information that everything looks fine. The only thing they can give you is some medications or refer you forward to IVF. And you really want to get to that root cause of what's keeping your body from having regular periods, from having the best chance at getting pregnant with PCOS. Then I invite you to reach out and book a free call with me. This is a free PCOS fertility breakthrough session where you and I are going to talk about what's been going on in your body and your fertility journey over all these years. What's been keeping you stuck? What are these missing links for your body that need to get put together so that you can start turning your fertility around? That's what I'm going to help you uncover when we're on this call. And I will help you figure out what is the most important next step that you can take in order to turn around your fertility and get the best chance at getting pregnant with PCOS. So you can sign up for one of those at drangelapotter.com/PCOS. And as a reminder here as we wrap up today is that this podcast is for informational purposes only, and it should not replace the medical advice that you are currently getting from your doctor. And if no one else has told you this today, then I want to be the one to tell you that I believe in you, and I believe in your ability to get to the root cause of what your fertility struggles are and to turn those around so you can start seeing results in your body. Have a wonderful day. I will see you right back here next week.